Assalamualaikum and a very good morning, albeit to the honorable judges, respected timekeeper, fellow presenters and members of the hall. I am Nadia Ismail, co-founder of Yalla charity organization. I started studying Bachelor of Dental Surgery in Alexandria University in 2011 and I recently graduated from Ames University, Malaysia on the 8th of October. Today, I would like to share on our topic of connecting communities and providing healthcare through volunteerism. First and foremost, allow me to share a brief introduction about our organization. Our organization was founded by a group of medical and dental students studying in Alexandria University in Egypt. Upon my transfer to Ames University, Malaysia in 2013, I co-founded our first branch locally in Kedah. We are officially registered with the Malaysian Registry of Societies and the Malaysian Embassy in Egypt. I would like to explain regarding our logo and motto. Yalla is an Arabic term which means let's do it, or in this context, let's do charity. Our motto is spread the love and heal the world, and our aim is to spread the spirit of volunteerism all across the globe. We have an active committee of 56 committee members and hundreds of volunteers. The senior members provide guidance and training to the junior members who we elect as project managers. They, in turn, have to find funds and volunteers, which will enable the volunteers to connect with the local communities through our projects. Our main focus of our organization is poverty, healthcare, welfare, and education. We aim to connect the communities by creating connections between the volunteers and the local communities by allowing them to visit education centers, orphanages, special needs children, old folks' homes, hospitals, and rural villages where they will be able to get rapid and also learn the culture of the locals. From 2011 until 2016, we have accomplished a total of 118 projects, including 95 projects in Egypt, where we have established and donated to hospitals and rural villages, 9 projects in Malaysia, where we have worked with Rohingya refugees and also old folks' home, 2 projects in Tanzania, where we have visited the orphanage in Dar es Salaam and Muhimbili National Hospital, 1 project in Thailand, where we have provided donations to the local community in Koh Puyu, Satun, and lastly 1 project in Greece, where we have supplied medical supplies to Moria refugee camp in Lesbos. As medical and dental professionals, we believe that prevention is better than cure and that education is the best medicine. Therefore, we focus on healthcare education, where we teach them basic hygiene techniques such as toothbrushing technique and hand washing technique. Besides that, we also provide educational and motivational talks to increase the positive impact on the children. From the first project, which is the Pioneer Program, we create a close bond with the community by doing follow-up visits. As you can see, that was me in 2012 holding an orphan in Dar El Afaf orphanage. His name is Yusuf, and this is one of our co-founders also, Ms. Fatima Zahra, who just visited the orphanage in 2016. And through these follow-up visits, we are able to have a deep friendship where the children will be able to remember us as they grow. And this also establish connections for more future projects. As we are also focused on children's growth, we do periodic follow-up visits to check on their health, psychological well-being, and also establish a long-term friendship with them, which in the long run has a positive impact on on the overall well-being of the children. And our next and biggest project in Malaysia yet is Project Orchid, which is a 4 days, 3 nights health and education camp, which I am the project manager in collaboration with Islamic charity, the Pelangi Project and the Pelangi Project. It will be held from the 24th to the 27th of November in Kedah Darul Aman. And we are focused on 2 venues which Yalla has done our projects previously. The first is Rohingya Education Center, which is actually a school for Rohingya refugees. And the second is Rumah Penyayang Wadi Sakinah, an orphanage for underprivileged children. Then we'll be conducting a medical and dental checkup at our mobile clinic at the Rohingya school on the 26th of November. We aim to provide screening and treatment to 120 adults and children from the Rohingya refugees community in Sungai Petani. This will be carried out by 2 dental officers, 1 medical doctor and 1 optometrist, and will be assisted by medical and dental graduates and students. Our long-term plan for Yalla is to create a sense of sustainability in our projects. Therefore, we hope that our donations to hospitals, education centers and mosques will be able to create a positive impact on the local community in the long run. I would like to share some of the major projects that we have done. The first being Project Iqra. Project Iqra was initiated from 27th July 2015 until present. It is done in Kaf Harif, Amria, Alexandria. There is a small rural village in Alexandria. This is actually an education center that we help to build by giving donations to the local people, because actually Egypt is some of the parts of Egypt is a very poor country where they lack their resources for funding. With all the political turmoil that happens, it's a very tough situation for them to actually get education. So what we hope to establish through Project Iqra is to aid in raising literacy and fund their education, and to provide facilities and necessities for teaching skills for the women and single mothers in the rural area. This is actually a community learning center, a 2-level building. The first level, which is just completed and officiated, is an education center for children, and the second level is a community learning center for the women, for them to learn basic skills such as sewing. The second is an Alexandria Pediatric Operation Room in Pediatric Department Shatbi Hospital in Alexandria. I would like to clarify that when we imagine hospitals in Alexandria, it's not even to the level of our government hospitals. If I were to equate it, I think it doesn't even reach 50% of our hospitals. So due to the lack of funding, their amenities and facilities is very, not up to standard. And here at Yalla, we have actually collaborated with the ASEAN Committee in Cairo, who gave us a huge sum of donations of 100,000 Egyptian pounds, and we finally were able to establish new operating rooms with new equipment for them to be able to do more operations and to operate on more people. The third is mosque renovations in Alexandria, where we have done renovations in 3 mosques simultaneously from June 2015 until May 2016. The mosques that were included is Islah Mosque, Abu Jubair Mosque, and Baitkom Al-Sharqi Mosque in Abu Mutamir, Cairo, Alexandria, Desert Road. Our donations for all these 3 mosques includes ceiling fans, carpets, building materials, paint, water cooler, vacuum cleaners, and Al-Quran. And we hope that these projects will enable the local communities to use the mosque for various purposes for a very long time. I have recently done an online survey on 43 respondents to evaluate the impact of our projects on the volunteers. And from our survey, we have found that our projects has affected them in a positive way and has enabled them to connect with the local communities. In a nutshell, from my 5 years of being a Yalla, we call ourselves Yalla Rangers. From my 5 years of being in volunteerism, I feel that it has a positive impact on both the person who receives the help and also us who give it. And personally, I have gained so much. I have gained so many new experiences, many new friendships, and also learned the value of empathy and trust and motivation from our projects. By increasing healthcare and reducing poverty, we managed to improve the quality of life of all the people that were involved in our projects. I would like to end my presentation with a quote from John F. Kennedy. If not us, when? And if not now? Sorry? If not us, who? And if not now, when? Therefore, I, on behalf of Yalla, charity organization, sincerely hope that every one of us will continue to spread the love and heal the world in our very own ways. That's all from me. Thank you.
Thank you, Ms. Anis Nadia Ismail, for such a wonderful presentation. We will now open the floor for the Q&A session. Yes?
I want to ask, your volunteerism is more focused on education or in terms of poverty or what? I'm not clear on that.
Our organization is actually a broad spectrum, but actually both poverty, elevating the standard of life by providing donations. For example, we usually do projects where we go to very rural villages, where we provide packs of donations such as rice and flour and the basic necessities. And also we go on homeless hunts in the streets of Alexandria because there are literally beggars everywhere. So we give donations to them also, but at the same time, because we are so connected with so many different orphanages who lack the access to education, we also, in a way, by monitoring them and providing, for example, Project Ikra, where we created an education center, we hope that these children will be able to live a more privileged life in education. And one thing that I would like to share personally, because in Alexandria we use trams to go from here and there, and on one side you will see one child from the better privileged families carrying books and carrying bags going to school in uniform, and on one side there's a small kid this size. They will carry boxes of things to sell, and they would actually go from train to train. So there's actually such a difference in the level of access and privilege, and we hope by our small deed we are able to help them to actually at least try to reach that level. Thank you.
Thank you. Is there any more question? Yes. Please.
Okay, thank you. So, I'm just from Indonesia. I'm interested about your organization that has applied the Items project. So we know that funding is the main important for organization to be able to run well. Can you explain to us about the funding? How you can raise funding for your organization? And the second is, what is your advantages of your organization and other organizations that have same field? Thank you.
Thank you for the question. First and foremost, I will answer the question about the funding. For our funding, we actually have two levels. One, usually because we have this monthly project where we have different project managers, and we actually have a yearly schedule of what projects we are going to carry out. So because in Alexandria the Malaysian community is very big, so usually in our lecture halls we always have one committee member who will distribute the donation boxes, and that is one source of our funding. And the second, which is the major funding, is that we managed to connect with private companies. For example, one of our biggest funding is from a company known as Equal Weighing Systems in Jamahat, and Project Ikra is primarily funded by them. And also for my projects in Malaysia, we received a 5,000 donation from Datuk Mukris Mahathir, who actually went to Alexandria at one time, and we spoke to him, and we actually got 5,000 there, and that is the money that we use for most of the projects in Malaysia. And in terms of that, I think it's very important for us to establish ourselves as a trustworthy organization. And at Yalla, actually how we do that, how we gain people's trust, is that if you open our Facebook page, every project that we have, we put all the pictures of our program, pictures of the things we bought, pictures of each receipt that we use, and that we actually share the report from A to Z. Who are the volunteers? How do we who donated, and how much of the total donations? What from the biggest thing until the smallest thing, until even each plastic that we use. We list that down, and people can see, I know where my money went, so I think I want to give more. And I think that is a very important part of fundraising, to gain people's trust and establish yourself. Because in 2011, we started from nothing. And when I came back from Malaysia to Malaysia, I actually just started the branch from Yalla on my own, and Alhamdulillah now we are almost in our 10th project. And I would like to share, because Project Orchid I'm the project manager. It's my first major project, and I actually, because it's my first project, so I just the basic budget that I estimated was just 7,000, because at first I wasn't sure whether I would get that much. But Alhamdulillah, in a matter of 2 months, we have now reached 10,000 ringgit, Alhamdulillah, and we have so many more. When we have more, we can give more, and I believe when we give more, we will receive more as a person. Thank you.
Any more questions? Okay. Thank you, Ms. Anis Nadia, for a very informative presentation.